Hello everyone, welcome back to my channel The Physiosapien, and today we will be learning about the next joint of the shoulder complex, that is glenohumeral joint. Glenohumeral joint is a ball and socket variety of synovial joint. It comprises of two surfaces, that is the proximal surface consists of the glenoid fossa, which is retroverted 6 to 7 degrees. So it faces in the backward direction 6 to 7 degrees, and the distal surface includes the head of humerus, which is a part which is 1/3 to half of part of complete sphere. So it is a part of sphere and not a complete sphere, and if we were to complete this sphere, it would be half to 1/3 of the complete sphere, and it faces medially, superiorly and posteriorly. Glenohumeral joint has 3 rotational and 3 translational degree of freedom, so it can undergo flexion extension, abduction adduction, internal and external rotation, and hence causes the glides and slides according to the movement. Next, it is a very mobile joint. As we can see, we have flexion extension, abduction adduction, internal and external rotation and circumduction. So it is highly mobile, it has great range of motions, and hence, as you have discussed before, higher mobility comes with lower stability. So it is highly mobile, but it is highly unstable, and it gets dislocated very frequently in day-to-day life. Next, we have two angulations which help in the congruency of the glenohumeral joint. These are angle of inclination and angle of torsion. So angle of inclination is an angle in the frontal plane. So it is between the axis connecting the head of humerus and the neck and the longitudinal axis of the shaft of humerus. So this angle is the angle of inclination. It is usually 130 to 150 degrees. Next, we have angle of torsion. Angle of torsion is in transverse plane. It is between the axis passing through the humeral epicondyles and the head of humerus and the neck of humerus. So if we view the humerus from the top, so here we have the epicondyles. So this is the axis of humeral epicondyles, while this is the axis of between head of humerus and the neck of humerus. So this plane with this is the angle of torsion. Angle of torsion is 30 degrees posteriorly. So head of humerus is usually retroverted, and if the antiversion of this increases, if the antiversion increases, it results in increase in the medial rotation of the glenohumeral joint, while it decreases the lateral rotation of the glenohumeral joint. If the retroversion increases, the medial rotation decreases while the lateral rotation increases. Next, we have attachments of the glenohumeral joint. These include glenoid labrum, joint capsule, glenohumeral ligament and coracoacromial ligament. First is glenoid labrum. It is a fibrocartilaginous rim which is attached on the periphery of the glenoid fossa. It increases the concavity of the glenoid fossa by 50% and thus helps in increasing the congruency of the joint. It also helps in lubrication of the joint, acts as a shock absorber, resists humeral translation and protect the edgy bones of the glenoid fossa to prevent trauma to the glenoid fossa during any movements. Next, we have the joint capsule. The joint capsule of the glenohumeral joint is large, loose capsule. The capsular surface is twice that of the area of the humerus, and it is taut superiorly and slack inferiorly and anteriorly in resting position, and thus the dislocation, because of this, the dislocations usually occur anteriorly and inferiorly. The third one is the glenohumeral ligament. It attaches from the glenoid fossa to the head of humerus. So it has 3 bands, superior, inferior and the middle band. It helps in anterior and inferior stability by preventing anterior and inferior translations during the movement. So basically it acts as a reinforcement to the joint capsule, which is slack anteriorly and inferiorly. The next one is coracoacromial ligament. So as the name suggests, it attaches from the coracoid process to the acromion process, and it helps in the preventing the inferior translation of the humeral head. Next is a special mention, which is the coracoacromial arch. It consists of the coracoid process, acromial undersurface, and the coracoacromial ligament. So what does this coracoacromial arch help us with? It protects the subacromial bursa, rotator cuff tendon, and the tendon of long head of biceps brachii superiorly. So this coracoacromial arch helps in protecting all of this if the coracoacromial arch was not present. Okay, then let's take an example. You have done any movement, or there is any trauma to your shoulder. The bursa would be affected, resulting in bursitis. It will affect the rotator cuff tendons, which helps in the stability of the shoulder joint, and it will also cause trauma to the long head of biceps brachii. So all these organs would not be protected if it were not because of this. Next, coming on to the kinematics of the glenohumeral joint. It includes osteokinematics and arthrokinematics. So coming on to osteokinematics first. It includes the movement, the plane and axis of the movement, and the range of motion with its restrictions. So the first movement is flexion of the glenohumeral joint. The plane for the same is sagittal plane and the axis is coronal axis. The range of motion of flexion is 120 degree. So you might be wondering why the range of flexion is 120 degree when we can move our arm up to 180 degree. So 120 degree is pure glenohumeral range. The remaining 60 degree is contributed by the scapulothoracic movement, and thus a total of 180 degree of shoulder flexion is attained. The next moment is extension, which also occurs in the sagittal plane and coronal axis, and its range is 50 degree. The next moment is abduction and adduction. Both occur in coronal plane and anterior-posterior axis. The range of abduction is 120 degree with 35 to 40 degree lateral rotation, so that the greater tubercle can pass the coracoacromial arch. So what does this mean? Okay, now we have the scapula and the humerus. So this is the neutral position, anatomical position. So if we try to abduct, you can see there is restriction by the acromion process to the greater tubercle, right? So if we laterally rotate this 35 to 40 degree, okay, now we do the abduction. So you can see that the greater tubercle passes behind the coracoacromial arch and the abduction can be completed. Hence, lateral rotation is important so that full abduction can be attained. And the range of adduction is relative to the abduction. So whatever the amount of abduction you do, relatively you can do the adduction. Next is medial rotation and lateral rotation. Both occur in the transverse plane and vertical axis. The range of medial rotation is 60 degree when arm is beside you. So in normal anatomical position, it is 60 degree, while if you abduct your shoulder to 90 degree, the range increases to 120 degree of medial rotation. And the lateral rotation is similar, so it is relative to the medial rotation. The second part is arthrokinematics, which include movement and the direction of roll and glide according to the movement. So in open chain kinematics, the head of humerus moves over the glenoid fossa of the scapula. So according to the concave convex rule, so this surface is convex and your glenoid fossa is concave. So the direction of roll and glide will be in opposite direction because the convex surface is moving on the concave surface. So during flexion, the roll is in anterior direction while the glide is in posterior direction. So let's try and do our flexion. So the roll is in anterior direction while the glide is in posterior direction. Okay. Now similarly in extension, it is exact opposite. The roll is in posterior direction while the glide is in anterior direction. So the roll is in posterior direction while the glide is in anterior direction. For abduction and adduction, the roll is in superior direction and the glide is in inferior direction. So abduction, okay, after doing lateral rotation, abduction, so it is rolling in the superior direction while it is gliding in the inferior direction. And the opposite, during adduction, the roll is in inferior direction while the glide is in superior direction. Now, medial and lateral rotation. In medial rotation, the roll is in medial direction while the glide is posteriorly. So, medial rotation, okay, the roll is in medial direction while the glide, see, you can see it is gliding posteriorly, okay. And similarly, for lateral rotation, the roll is in lateral direction while the glide is in anterior direction. So, lateral rotation, you can see it is gliding in anterior direction during lateral rotation. So the next topic is kinetics of glenohumeral joint. It consists of static stabilization and dynamic stabilization. So what is a static stabilization? Static stabilization is that the head of humerus is stable against the glenoid fossa in a static position. So when during no movements, when the arm is at the side, at that point the head of humerus is stable against the glenoid fossa. So we know that the congruency of head of humerus with the glenoid fossa is very less. So it is the least stable joint of our body. So it cannot be stable on its own. So what all things make it stable? Okay, when the arm is on the side, the force of gravity is acting parallelly against the shaft of humerus. So it is pulling it downwards. So there is inferior translation of the humerus. So the passive forces of deltoid, supraspinatus and the long heads of biceps and triceps, all this helps to prevent the inferior translation by the gravity. And the passive tensions of rotator interval capsule, which includes the glenohumeral ligament, the coracoacromial ligament and the superior capsule, all of these become taut to prevent the inferior translation of the humerus against the gravity. Also, the capsule on the glenohumeral joint is airtight, and which creates a negative intra-articular pressure, which helps in the inferior translation of the head of humerus. Also, if the glenoid labrum is tilt upwards a little bit, so this is the normal position. If it gets tilt a little, so it can give a bony obstruction to prevent the inferior translation of the head of humerus. In case all these things fail, or in case where there is excessive load on the arm in static position, for example, you are carrying a heavy load of bucket, at that time the load exceeds the amount we can resist. Okay, in such conditions, when the passive forces are insufficient, supraspinatus is recruited for active assistance. So here it was working as a passive forces, but during excessive load it acts as a active assistance, it contracts actively. Okay, next, coming on to dynamic stabilization. Dynamic stabilization is done by deltoid, the rotator cuff muscles. These are the sits muscle, SITS, supraspinatus, infraspinatus, teres minor and subscapularis, and the long head of biceps brachii. We will be learning about each one of them individually in the next slide. So the first dynamic stabilizer of the glenohumeral joint is deltoid. Deltoid, as you all know, is a prime abductor along with the supraspinatus muscle. It has three heads: the anterior head, the medial head and the posterior head. All these three heads have their own line of pull, but the resultant action of pull is along the middle fibers of the deltoid. Okay, so the resultant vector FD, okay, it has two components: the translatory component, that is Fx, which is along the shaft of the humerus, it is very large, while the rotatory components, which is perpendicular to the head of humerus, is Fy, which is very small. Because this component is very small, it cannot undergo abduction on its own, so it requires the help of supraspinatus to do the abduction. Okay, now Fx, which is the translatory component, usually the translatory components along the shaft have stabilizing effect, but in this case it does not have a stabilizing effect, rather it has a shear effect. It produces a shear force. Why does it produce a shear force? Because the head of humerus is not in the line with the shaft of humerus. Okay, so here you can see the shaft of humerus, the head of humerus has an angle of inclination, so it is not in line with the shaft of humerus. Okay, therefore the force producing creates a shear force with the shaft on the head of humerus. Next is the rotator cuff muscles, which include supraspinatus, infraspinatus, teres minor, and subscapularis. So the infraspinatus, teres minor, and subscapularis have a similar line of pull. Okay, so the perpendicular component compresses and rotates the glenohumeral joint, while the translatory component offsets superior pull of deltoid. Okay, so the pull of deltoid is balanced out by the pull of ITS muscle. Also, the teres minor and infraspinatus contribute to the abduction by laterally rotating the glenohumeral joint, and thus the greater tubercle passes the coracoacromial arch. Okay, now the supraspinatus muscle, the line of pull is farther from the glenohumeral joint axis because of its superior location. Okay, so it has two components, the translatory component and the rotatory component. So the translatory component is in the superior direction, that is, it is directing upwards, which cancels out the force by the gravity which is downwards. Okay, therefore it is a stabilizing force. And the perpendicular component, which is compressive in the medial direction, is very large, and therefore supraspinatus can individually abduct the glenohumeral joint on its own. Therefore, the combined action of deltoid and SITS muscles help have an equal and opposite superior and inferior translation, which helps in balancing them out, and therefore there is very less amount of translatory movement and almost perfect rotation of the glenohumeral joint. The final muscle which helps in the dynamic stabilization of the glenohumeral joint is biceps brachii. It helps by centering the head of the humerus in the fossa and by reducing the superior and inferior translations of the humerus. So one important mechanics of the shoulder complex is the scapulohumeral rhythm. Okay, so it is between the scapulothoracic joint and the glenohumeral joint. So what it says is that the scapulothoracic movement, the movement of scapula on the thorax, contributes around 50 to 60 degree during shoulder abduction and flexion, while the glenohumeral joint, that is the movement of humerus with the glenoid fossa, contributes around 100 to 120 degree during flexion and abduction. So it is a ratio of 2 degree of glenohumeral joint movement to 1 degree of scapulothoracic joint movement. So what importance does this play? Majorly, it improves the range of motion of the shoulder complex. It helps to keep the glenoid fossa in position, and it maintains optimal length tension relationship. So this was all about the shoulder complex. I know it has been a long video, and I hope you enjoyed the video and learned a lot from these videos. And let me know in the comments if you have any doubts regarding the same. You can also DM me on my Instagram. The link for the same will be given in the description. And hope to see you in the next one. It's Anak Chandak signing off.